celebrated every year on 7th of April across the globe with an objective to raise awareness of diverse stakeholders on various health issues. The theme of World Health Day 2022 is Our Planet, Our Health. Amid the COVID-19 pandemic, increasing environmental issues like global warming and the rising burden of non-communicable diseases like cancer, asthma, heart diseases, an urgent action is needed to keep humans and the planet healthy and foster a movement to create societies focused on well-being. With this background, I invite you all to the round table panel discussion of elected state doctor representatives of Punjab, which has been organized by the Department of Community Medicine and School of Public Health PGI Chandigarh in collaboration with Indian Medical Association Chandigarh and Strategic Institute for Public Health Education and Research Chandigarh. The topic of today's panel discussion is Politico-administrative commitment for saving our planet from rising NCDs. So I welcome you all, and before we proceed, I request you all to kindly give you a brief introduction.
I'm Parul from the Indian Express. I handle features and health for the Indian Express here. Hello, I am Taruni Gandhi. I am principal correspondent from the Sunday Guardian, and I handle all these parts of India, from Leh Ladakh to UP, in terms of health, politics and everything. Thank you. Hi, I am Kavita. I am from Amar Ujala, and I cover basically education and now human health.
I am Dr. Ravinder Singh Nagpal. I represent NGOs of Punjab, and our NGO is working in the health sector for the last 25 years.
Hello everyone, I am Dr. Alamjit Singla, and I am representing Dr. Vijay from Road, and I am working as a dermatologist in civil hospital Musa and the district. I am also catering Road every week in one of the openings.
Hi everyone, I am Sarita Verma and I am member SIPHER. Hello, this is Devu Mahajan, Finance Secretary, SIPHER.
Hi, I am Dr. Harjeet. I am retired SM of Form 16, and my new identification is I am Dr. Mrs. Dr. Charanjit Singh, who is elected as MLA.
Hello, I am Dr. Ramneek Sharma. By training I am a gynecologist, but presently I am IMA Chandigarh and also chairperson Surya Foundation. So I am related to health in many ways. So welcome this discussion. Thank you.
Welcome you all. I am Dr. Rakesh Gupta. So SIPHER, IMA, we are working together, and Vijay Chandigarh, Department of Community Medicine. So we have organized this World Health Day, and I am working with SIPHER as well.
I am Dr. Charanjit Singh, and I am ophthalmologist by profession, ex-PGI, and at present I am MLA from Discourse.
Good afternoon, I am Dr. Nitin Mathur. I am an ENT surgeon and an allergy specialist. I am the ex-secretary of the Indian Medical Association.
I am Dr. Kapil. I am a surgeon by profession. I am ex-president IMA Chandigarh. I just gave the charge to our current president.
Dr. Vijay.
Hi, good afternoon everyone. Dr. R.S. Bediz. I am currently advisor to World Medical Association and past president of IMA Chandigarh. Thank you. And a pediatrician by profession.
Good afternoon. I am Dr. Rana Jason. I am a chest physician. Currently, I am working as a Deputy Regional Director with International Union Against TB and Lung Disease, and I am supporting countries of Southeast Asia region in tobacco and NCD control. Right now, I am based in Delhi, and now it's almost I being my own state, so I always feel very happy and closely working with the governments, all state government of Punjab, for tobacco and NCD control. So I always feel very happy to be back to my state. So thank you, sir.
Hello, good afternoon everyone. Myself Dr. Healthiest, District Health Officer, Hon'ble, working on Discourse since 1.5 years. And I also greet our worthy MLAs for new government. I especially I am very much thankful to Dr. Gupta for giving me an opportunity to join with you on this occasion. Thank you everyone. Thanks.
Good afternoon everybody. I am Dr. Gupta, Director internationally of SIPHER company, deals with water, nationally and internationally. Thanks to Mr. Dr. Rakesh Gupta who had invited me here to be a part of this forum, and congratulations Mr. Charanji for such a good winning in your elections. Thank you.
Hi and good afternoon everybody. I am Arun Verma, Director of Finance and Operations, Strategic Institute of Public Health Education Research, SIPHER. I congratulate Mr. Charanji Singh not for becoming a member of this family, but for defeating our former Chief Minister. I welcome you all. Thank you.
And he's still doctor, sir. He's ophthalmologist.
I know that.
Good afternoon all, myself Rajiv Chaudhary, and I'm working with PGI as a project coordinator for looking after the tobacco control program.
Good afternoon everyone. Myself Dr. Sonu Goyal, working as professor in Department of Community Medicine and School of Public Health, PGI Chandigarh. And I think I'm really blessed and feeling very happy to be a part of this august gathering comprising of media, the politicians, and who are doctors actually, and looking forward to hearing from you all.
Hello everyone, I am Dr. Ratnakshi Khan and I am an intern with SIPHER.
Good afternoon everyone, I am Dr. Supriya and I am an intern with SIPHER. And right now I am working as a technical officer for tobacco and game in a PID union project in the Department of Community Medicine, School of Public Health, PGI. Now I go ahead with today's proceedings, and without further delay I would like to invite Dr. Sonu Goyal to deliver welcome address and give a brief introduction of the topic. And Dr. Goyal has 18 years of experience in the field of public health. He is currently working as a professor in the Department of Community Medicine and School of Public Health, PGI Chandigarh. He is recipient of various awards including Young Researcher Award by IPSM Ford Foundation, Harcharan Sikoration Award, Vasudeva Oration Award, many more to his credit, and Vice Chair of Tobacco Control Section and leading Empowered Research Group of the Union. I welcome you, sir.
Thank you, Nidhi. So I have already given my introduction. So basically, this panel discussion was intentionally held on a very strategic day, that is a World Health Day, which is not only celebrated in India but celebrated globally on 7th April every year. And today the theme of World Health Day is again very apt, and it is related to, it's a very generic theme, and it is related to our planet, our health. So everybody knows that only when we protect our health, then only we can protect the overall planet. So that is the role of all doctors who are all here in different capacities. Some are holding some positions, some are holding technical posts, but overall we can say that basically we are all doctors, and we are all proud of being doctors because we are protecting health of people. So that is our main aim. And today's discussion, I just want to highlight today's discussion that it will be sharing of our ideas, and our vision for how we can make Punjab a healthy state. So I have been working in state of Punjab for various activities for last 10 years. Since 2009-10, I have started working in tobacco control in state of Punjab. So we started with the district Mansa, and Mansa was the first Mohalli. First of all, Mohalli was the first district which was declared smoke-free. So we started with Mohalli district, and then we go with Mansa, and then in 2016, by 2016, we have technically supported the state of Punjab in declaring most of the districts, almost all districts, as tobacco smoke-free, and Punjab was given the honor by World Health Organization as in the World No Tobacco Day, and Punjab won the award for No Tobacco Day. Just want to highlight one more thing, that Punjab has been a pioneer for many activities in tobacco control. It was the first state where the e-cigarette, electronic cigarette were banned. It was banned way back in 2013. Dr. Rakesh Gupta is there, so he was the nodal officer of the tobacco control program. And you can realize that Government of India banned in 2019. So we are way ahead, 6 years ahead than Government of India in banning the electronic cigarette. Then various other activities were there in Punjab, banning of hookah, banning of, implementation of Juvenile Justice Act, which says that if somebody is selling tobacco products to minors, that person can be imprisoned for 7 years. 7 years. So Punjab was one of the states where 3 cases were filed against those people who were selling tobacco to minors, and they were jailed for 7 years. So that was a big deterrent, and that was in big news in most of the media at that point of time. So I mean to say that Punjab has been doing a great job in various aspects of health, and I think by the newly elected legislators who have come here and who have joined, Mr. Charanjit Singh who have joined here, so I think we can find that vigor. We have seen in New Delhi that how the health has been transformed by the government 7-8 years back, and now it has been Mohalla clinics has been a talk of the town, and not only talk of the town but also it has been recognized world over, and the US President has come over to see that how this Mohalla clinic has been functioning. And so this is the thing which we want in Punjab, that people should come over in Punjab to see how the health is being functioning in the state of Punjab. So this is our expectations from this panel discussion. Let us all share what we want. I think we have people from select people from media, we have people from NGO, we have people from medical association. Dr. Bedi is here, Madam Ramnik is here. So I think want to hear from them that what all we have been doing and what all we expect the state of Punjab to do further. So I welcome you all to this wonderful consultation, a short consultation, and we look forward to hearing the views from everyone. Thank you very much.
Now we will be starting with our panel discussion. So I would like to announce here that Health Minister Punjab is coming in another 10 minutes. So he will be joining us. So we shared the questions of panel discussion with all the MLAs beforehand, so that if they are not able to come, so they can share their responses with us. So we have the responses from Dr. Baljeet Kaur. So Dr. Baljeet Kaur is the Honorable Minister of Department of Social Security and Development of Women and Children, and she has done MS Ophthalmology from Baba Farid University of Health Sciences in 2010, and she has been awarded for doing the maximum surgeries in 1 year. And on behalf of Dr. Baljeet, we have Dr. Alamjit Dhillon from Muxar. He is posted as a dermatologist in the Civil Hospital Shri Muxar Sahab and Malone. So we welcome you, Dr. Alamjit.
Good afternoon, everyone. And I'm honored that I'm representing Dr. Baljeet here. She has some prior commitments, so she couldn't make it. And I was lucky enough that I was with her when she was serving in PGIMER as an ophthalmologist. And we shared her workspace, also work environment. I've seen the way she's working, the way she has worked. And that was a thing that we look forward to, like to see her attend the OPDs, 300, 400 OPD daily, and then also do some operations which were like in number of 80 to 100 operations every day. So she had sent me the response to the questions that were put forward to her. The first thing that was to be discussed was about the NCDs, the amount that 60% of the death burden that all that is, how do we manage all this. So for the response, she mentioned specifically that basically it is timely intervention, early detection, and regular prolonged treatment, because this is a chronic condition. We know we cannot put it out of the system. It will stay with the patient. So the treatment has to be continuous. It has to be started at early detection. Has to be detected early and continue properly. So for that, initially it is about screening camps. As we all know, we have been organizing. But then the view she gave was that screening camps can be a trigger. It can do the awareness part. But eventually people have to realize that it's basically civil hospitals and these are the health centers that we have in the government. They can act as a permanent screening center for everyone. People should be encouraged that they can visit any time and get their things detected as early as possible. With that awareness, in awareness activities, we have the field staff, ANMs and ASHAs, that they have to be sensitized. They have to be told and informed what it is, what the diseases are, and how silently they can care the patients. And accordingly, they have to be, more rehearsed with the things and how to educate people about how to get and how to know that what conditions they might be suffering from. People, they don't realize that they have all these conditions, but still they continue living with that. And then we have all the NGOs. They can be involved in this. NGOs can have these awareness camps, which again, the reach that the NGOs have, even we government sectors, we can't match that. We can try, but then NGOs, if we involve them in all this, that's another thing she was planning to. Colleges more than schools for the non-communicable diseases. She was concentrating, she wants that colleges should be more involved. Schools can be a little bit, we can give them heads up. But then the colleges are basic places where we can educate. They are more responsible. They can cater to their parents also, to the elderly. They can check for them, and they are more aware. And then we have the social media and TV, advertisements, local newspapers, Facebook pages we have. That should be involved. And personally, at personal level, she plans to do that in Malod, the constituency that she is representing. Then after you have done all this, it's a long process. It is not going to be an overnight thing. So people, the education, everything, it will take time. And after that, it is once they are aware of the condition, next step is the availability of drugs. So drug availability is very, very important. For that proper, like with PGI, we can have the disease burden studies. Particular areas can have more diseases. Accordingly, specific drugs can be made more readily available in the government facilities. So, and in chronic diseases, it's very important to know that we can't treat them like एक महीने के लिए दवाई देती, and after that they come back again and we don't have the drugs. They need it regularly, and the load of the disease has to be quantumized, and accordingly the drug availability should be made. Again, food and water. So that's basically treating the condition from the grassroots level, right? So food should be equally regularly sampled. Water quality should have to be at least in the constituency at her level. She plans to do that. Water cleanliness and the drinking water availability, that should be there. So all these things may, with time, help in decreasing this load of 60% deaths. But then that's a thing that we have to plan out and chalk out, and she plans to do that. Second thing, the gaps in the infrastructure, specifically talking about the Malod area. We know that Malod as of now is suffering from lack of doctors. She plans to fulfill as soon as possible all the specialties. As of now, we are only currently running 3 to 4 specialties there. And in emergency, we have, I think 1 or 2 medical officers only those were getting. A couple of doctors had prior commitments, so they had left the job. But then she plans to do that, and the new 100-bedded hospital with proper diagnostic facilities is planned there, and it will be fulfilled in the near future. Jan Aushadhi stores are not there in Malod, but then we have only one Jan Aushadhi store in the whole district, which is in the civil hospital Muksa. So for proper and good quality drugs, let's say if not better than the one we have in the government supply, and also at cheaper rates, Jan Aushadhi store is being planned in Malod city, in city of Malod. We have Chak Sherewala is another area that has the boundary walls are there not in good condition. So she plans to build boundary wall and flooring part, and the roof also has to be done. So that part she has taken note of, and she is trying to do that. New buildings for sub-centers, couple of sub-centers have been identified. Buildings have been damaged to the degree of they being defunctional. So if they are defunct, so buildings have to be made. These are the things she has actually taken note of. So merging of Jila Parishad MOs just to get to the need of all the facilities, need of the health services and all that. So that merging of the Jila Parishad staff is and the post of the Chowkidars and Swai Sevaks will be sanctioned. So I've been asked to rush it up a little. And the problems faced by the private sector, that was asked. So in that, I think these are the global problems that every area is suffering in private sector. One is rejection and settlement of the bills by the government, where government bodies involved. Secondly, the public harassment and violence. So again, these have to be worked out at her level, that she plans to regularly do it, and the timely police has been informed that in case of private sector, the response of the police should be quick and should be adequate. We can't be complacent on that part. Personally also, being doctors, we know we've been suffering and we can suffer more. Academic institutes like PGI and NGOs, how do we plan to enroll, rope in them? So studies again, as I informed earlier, for the recognizing the disease burden, accordingly availability of drugs, that part can be taken care of. Training of the MOs and the pharmacy officers, specialists by the PGI regular for journalizing the treatment for these NCDs. That can be regularly held. Cleanliness drives for the plantation and done that again, we are getting at the basic level. That's it. That's it from her. Thank you. I'm honored to listen to that.
Before we proceed further, I think we can also present the responses from Dr. Ajay Gupta. He has also shared his responses. So Dr. Ajay Gupta, first question that he has mentioned about various plans for managing the NCDs like prevention, awareness, fitness, dietary habits, early detection which includes screening tests to be done according to symptoms and diseases like PAP for cervical cancer. Early treatment to reduce mortality according to severity, type of diseases in primary, secondary or tertiary care. So we will strengthen the healthcare system. Gaps in infrastructure and manpower, it is a main weak point, and it should be complete with corporate sector and world class, and I will pursue it. The government to procure world class equipment which give their productive value and systematic maintenance of these and infrastructure to reduce budgetary burden. Any healthcare needs proportional manpower, so we will increase the strength of doctor as well as highly trained support staff. The problems being faced by private doctors, nursing homes and corporate hospitals in the constituencies. So regarding private doctors in small nursing homes, they are more stressed due to changing and stringent rules to maintain standards in small and medium-sized buildings. Stringent laws against troubleshooting with proper and prompt execution, and corporate hospitals are out of reach for middle class and poor people. So rules should be made to make the cost of treatment procedure transparent and accountable, and fixing the rates will not fix the problem, rather corporate competition will reduce it and reserve some percentage of beds for poor patient as social responsibility of these hospitals. So how to plan to involve academic institutes like PGI Chandigarh. So faculty of PGI Institute of Academic Excellence will be involved to train the doctors, paramedics, technicians of government sector both professionally and academically on regular basis.
Points which are really important, so I think that is applause to you. And I think you highlighted integration of all the NGOs which are working in in Punjab. So that's a very welcome step. And you also talked about integration of NGO with the academia, with the government, with the Medical Council of India. So integration of all and thinking approach when we are planning for health.
Yes. One point I also missed, that when I started my career as a doctor, I formed my own NGO, Shuk Karman Healthiest. And we worked for I think 20 years. I was very active in that. I had camps right in Punjab, Haryana, Himachal, Uttarakhand, Delhi, and right up to, I think the last camp I had, that was Nepal, was just 25 kilometers off.
Wonderful.
In association with Healthage India.
Healthage India.
Wonderful, wonderful.
And though I have operated 65,000 eye surgeries, but 45,000 eye surgeries are in free. So, if I am an MLA today, that has played a big role, because in my area, I don't think there was any household who has not come to me for eye checkup.
Right.
And around 60% of my patients, even in my private clinic, they are free.
Right.
Yes, directly say that I don't pay.
Right.
So that has helped me.
Right.
Otherwise, defeating the CM was a challenge.
In fact, I am privy to some of the camps that were held by Dr. Charanji, and I think
Right. So I think big applause. So that's you have brought the health as a center stage for in the politics, and that is really important.
Actually, around 25 years back, when I was having eye camps, one of my colleagues, Dr. Sanjeev Sharma, he said, one day you will be MLA from this Discourse.
Okay.
20 years back.
Right.
So
right.
I think that I can call him the Nostradamus of my
So we welcome our State Health Minister, Hon'ble Vijay Singla, in this August gathering. So please have a seat. So sir, we are, before you came, we were all discussing about how we can think about making Punjab as #1 in health sector, because it has a potential. And I think many people who have been working in Punjab, including me, I am Professor Hon'ble, working as a professor in PGI Chandigarh, so in community medicine department. So we all told that since 2010, working in Punjab, so we made this, make as a tobacco-free Punjab. And way back when other are thinking about it. So Punjab has a potential to be a #1. And since a dynamic government of yours, and including the many doctor MLAs who have been in the seat of helm of affairs, so I think we can really make that. So I was, I think, discussing about the questions which we thought that thinking about the vision of Punjab, although I know that it is very few days you are here, but you have all been thinking about, and we have been seeing your manifesto also. We have been seen working of up in nearby states, where the Mohalla clinics were appreciated not only by India but also by the US and other governments. So we were asking Shri Charanjit Singh Janiji that what are the things which we are planning to do in Punjab in the immediate basis and the long-term basis. So I think, sir, he also told about he told about few things like integration of all the NGOs and making a common group in which we can all work together and think. And not only integration of NGOs, but integration of NGO with government, with academia, PGI, and all other people can think about how we can make a strategy for Punjab. So he also told about various other activities similar to Mohalla Clinic, which was there. And before Mohalla Clinic become operational, I think he told about strengthening of health and wellness center, which are already functional. So how we can strengthen the public healthcare system. So sir, we want to know about the things from you as well, that what is your vision, what is your thinking about the state of Punjab? Can we become number one and how?
So, since Dr. Singla, our worthy health minister, is here, I was telling them that I was in the NGO sector for the last 30 years. I had started my own NGO, Healthiest Society in '92. And through that NGO, I organized around 2,000 free eye camps. And in these camps, I operated around 45,000 eye surgeries. And the area of operation, it was a wide area from Punjab, Haryana, Himachal, Uttarakhand, Delhi. The farthest camp we had was in Uttarakhand, that was just 25 kilometers short of Nepal. And I think if I am an MLA today, then the social work played a big role in my being in the government today. And I was just telling them, because 20 years back also we had formed the apex body of NGOs. That included the NGOs in the Punjab, and we worked with the police. The police was also associated, and we worked in the field of de-addiction. But since NCDs, non-communicable diseases, they are causing a big mortality now. So we have to work on these, for these NCDs also. And for tackling this NCD problem, besides forming a body of NGOs and associating with the government, and once this body is formed, we can have detection camps in the fields, we can have training programs of the doctors and involve the big institute like Vijay and AIMS. Then we can have, there are a lot of funds in the center for NGOs, which have not been tapped for the last, say, 70 or 74 years. So if we form a big body like that, then we can also tap those funds and bring those funds to Punjab, and we can tackle this problem. So besides that, I was telling that as our government is going to have Mohalla clinics or field clinics, but it will take time, but in the short period coming, within 6 months, we'll have more wellness centers. Then we will also talk about, we will also involve the doctors and corporate hospitals. We should take their views about the Clinical Establishment Act, because many doctors or private doctors, they feel that this act has been one-sided. So we'll talk with the doctors and corporate.
So good morning all, and I welcome our Honorable Health Minister. He is the Minister of Medical Education and Research as well, Dr. Vijay Singla. So we are honored, sir, to have you with us. And Dr. Charanjit, he is an old ophthalmologist friend. We have worked together in Chandigarh. We have organized camps together. And it is an honor that now he is an MLA. And he can do a lot more about the people of that town, Chandigarh and around. So I'll be just briefly telling you about the World Health Day. It is one of the global health campaigns observed by the World Health Organization every year. And it is observed every year to raise awareness about the importance of the health and to mark the widespread contributions of our medical faculty. According to the WHO, health is fundamental to human happiness and well-being, and it contributes to the economic advancement, because healthy people, they live longer and they are more productive also. So this year the theme of World Health Day is our planet, our health. WHO will focus global attention on urgent actions needed to keep humans and the planet healthy, and the foster a movement to create societies focused on well-being. So it is a matter of pride for us that now almost 12 MLAs, they are doctors, and most of them are from your party, and some from one from Akali and one from BSP as well. So sir, I may tell you that we have an organization, Strategic Institute for Public Health Education and Research. We have undertaken more than 100 public health activities in collaboration with the Government of Punjab, with the Government of India, WHO, the International Union Against Tuberculosis and Lung Diseases, then Public Health Foundation of India, then Chandigarh University, Indian Air Force, then there is Guru Gobind Singh Institute, Guru Gobind Singh Indraprasth University in New Delhi. So we have organized camps with various activities with all of them. And we have also MOUs with top plexes, with the Healthy India Alliance, and with ICANN Care. So SIPHER's work in tobacco control and NCD control that has been recognized nationally and internationally. And SIPHER is also part of your Punjab's state level coordination committee, which is looking after NTCP. So we are part of that. And I may also tell you that I retired as Director Health Services Punjab in February 20. And before that, for 10 years I was looking after National Tobacco Control Program and National Program for Control of Blindness. So, and now I'll hand over to Mr. Arun Verma. Sir, he is Director Operations and Finance with SIPHER. So he'll be telling very briefly about SIPHER.
Good afternoon, sir. I am Arun Verma, as told by Dr. Rakesh that, but I am not a doctor by profession. I am an engineer by profession. But staying within the doctors, almost 50% of the medical education is already with me, sir. I am a retired managing director from the board, working with the Punjab State Electricity Board and then Punjab State Power Corporation. About this SIPHER, sir, the Strategic Institute for Public Health Education and Research, it was established in 2018 under the Society Registration Act with the purpose of creating a specialized public health workforce who can plan, execute and monitor national program and public health initiatives for tackling emergency public health issues. The aims and objectives of SIPHER are to develop, design and conduct capacity building program for public health managers, healthcare professionals, academicians, civil society, policy makers and other relative stakeholders on need-based basis diverse public health issues. To promote implementation and policy-focused research in order to develop and reinforce policies, strengthen monitoring and evaluation of the national program. To establish a technical resource center for public health issues. To develop technical resources like journals, books and magazines. To continue to organize or participate in academic or the research related seminars, workshops, collaborate with the institutions of repute or experts, to receive donations, grants for the society for furtherance of its objectives, to support and collaborate with the national and subnational programs. So, sir, I welcome you once again to this seminars and to this discussions. Now over to you.
Proceed further with the addresses of our guest of honor and chief guest. I would like to invite you all to the release ceremony of our few strategic reports.
Yes, I do participate.
आइए सौरभ जी, आइए प्लीज सर।
सौरभ जी आ जाओ। हाँ। I think we can have a group photo. Maybe लोग हैं, सबके साथ हैं। आप सारे जन आइए।
Not allowed.
We are not allowed.
That's the press. Yes, sir. आ जाओ।
प्रेम यहाँ पे आ गया।
और सभी हमारे डॉक्टर राकेश गुप्ता, डॉक्टर सोनू गोयल, डॉक्टर राणा, मेरे IMA के कलीग्स हैं, डॉक्टर बेदी, डॉक्टर कपिल, डॉक्टर नितिन एंड डॉक्टर हरजीत कौर एंड डॉक्टर साहब आए हैं डॉक्टर बलजीत कौर के जगह पर एंड एवरीबडी इन दिस रूम। आई थिंक हम यहाँ मिल रहे हैं, दिस itself shows the commitment of the government. They want to really take the health sector forward, मैं ये मानती हूँ। और जो बातें अभी यहाँ हम डिस्कस कर रहे थे, तो मेन बातों पे आते हैं कि नॉन कम्युनिकेबल डिजीज़ का जो अब इशू है और उसमें हम क्या कर सकते हैं, बिकॉज 60% एज डॉक्टर सोनू गोयल बता रहे थे कि दैट इज़ कॉजिंग ऑल मॉर्बिडिटी एज वेल एज मॉर्टेलिटी इन आवर कम्युनिटी। और उसके लिए कुछ सुझाव भी आए हैं, डॉक्टर बलजीत के भी कुछ आए हैं, डॉक्टर चरणजीत ने काफ़ी सारे बताए हैं हमें। तो उसमें डॉक्टर राणा ने एक बात कही जब उन्होंने अपना एड्रेस दिया कि जब लोड ज़्यादा है देन ओनली द क्लिनिशियंस मे नॉट बी सफिशिएंट टू टैकल द प्रॉब्लम, सो पब्लिक हेल्थ एटीट्यूड हैज़ टू कम इन। हमें अपनी क्लिनिक से बाहर निकल के कम्युनिटी के साथ जुड़ना पड़ेगा और उसके लिए सुझाव दे रहे थे डॉक्टर चरणजीत, जो मुझे बहुत वर्केबल भी लग रहा है और इफेक्टिव भी होगा। आई एम वेरी पॉजिटिव कि NGO सेक्टर, क्योंकि हमने बात की कि हमें कैंप्स लगाने चाहिए फॉर ऑब्जर्वेशन फॉर डिटेक्शन, लेकिन वो कैंप सिचुएशन बहुत टेम्परेरी सिचुएशन होता है। वी नीड समथिंग रियली परमानेंट टू एड्रेस दैट। सो उसके लिए अगर हम कोई परमानेंट स्ट्रक्चर्स क्रिएट कर सकते हैं इन पर्टिकुलर डिस्ट्रिक्ट, इन तहसील, वेयरएवर, गाँव में, पिंडांच, है ना, then where people can every day come and get themselves checked and then get treated. I think that will solve the problem rather than the camp situation per se. And अभी हम communicable को डील कर चुके हैं, अभी नॉन कम्युनिकेबल को एड्रेस करने की जरूरत पड़ रही है। और उसके लिए जो बता रहे सुझाव दिया है, क्योंकि हम कह रहे थे कि हम अपने फील्ड स्टाफ को करेंगे एम्पावर, है ना, हम ट्रेन करेंगे, लेकिन फील्ड स्टाफ इज नॉट गोइंग टू बी सफिशिएंट डॉक्टर। हमें NGOs की और बाकी लोगों की हेल्प लेनी पड़ेगी इसमें। सो आई थिंक वी नीड टू ट्रेन इवन द NGOs, bring them in and train them so that they can carry it forward into the community. So that can have a bigger impact as well as reach. जो NGO की reach है वो हम सब के क्लिनिशियंस की रीच से कहीं ज़्यादा आगे होगी। सो दैट्स अ वेरी वेरी गुड सजेशन डॉक्टर साहब का। ड्रग्स की बात करते हैं, अवेलेबिलिटी ऑफ ड्रग्स, डॉक्टर साहब ने बताया कि हम हमेशा शॉर्ट होते हैं। सो आई थिंक दैट इज़ वन सेक्टर वेयर हम रिक्वेस्ट करेंगे डॉक्टर साहब को कि हमारे ड्रग्स को रियली प्रॉपरली सारे अस्पतालों में और PHC में अवेलेबल हो जाएंगी, तो आई थिंक मोस्ट ऑफ द प्रॉब्लम्स विल बी सॉल्व। देन हम कह रहे थे कि 1 डॉक्टर पर 5000 पॉपुलेशन हमें चाहिए। मुझे नहीं पता कि पंजाब में एट प्रेजेंट क्या सिचुएशन है, बट बताया आपने कि काफ़ी गैप्स हैं अभी टू हैव दैट काइंड ऑफ अ सिचुएशन। तो मुझे ये भी कि वेलनेस हेल्थ सेंटर्स जो हमारे अभी चल रहे हैं, कैन दे टेक ऑन द लोड ऑफ दैट, लाइक दे कैन रीच आउट टू द पॉपुलेशन? इफ दे कैन, आई थिंक दैट विल बी अ वेरी वेरी गुड आइडिया एज ऑफ नाउ। एंड थैंक यू करना चाहती हूँ डॉक्टर राकेश का, डॉक्टर सोनू गोयल का, जिन्होंने ये फोरम यहाँ पर आज पैनल डिस्कशन के लिए इकट्ठा किया, बिकॉज दीज आर द पीपल हु आर गोइंग टू रियली मैटर इन द लॉन्ग रन। हेल्थ मिनिस्टर साहब यहाँ है, तो आई थिंक दैट स्पीक्स वॉल्यूम्स के वी आर वेरी वेरी सीरियस अबाउट द हेल्थ सेक्टर per se and doing some commendable work. And मैं अश्योर कराना चाहती हूँ, IM is always on the forefront to take all government schemes to the common man. So please, we are a very strong link and we would like to use that to improve the health sector. Thank you very much.
Always in the forefront on the health issues, and we assure you that all the government from sir side also I can give you assurance that we will always be with IMA and other NGOs also. And sir, I may just let you know that we have some special guests with us, Dr. Vinder and Mr. Atul Gupta Dr. Himanshu. So, Dr. Himanshu is from the Chandigarh University. Dr. Himanshu department. He is additional director in the University Institute of Applied Health Sciences. And Mr. Atul Gupta is with us. Dr. Rana is with us. Dr. R.S. Bedi, Dr. Kappal, Dr. Nitin, and we have Madam Mrs. Charanjit is with us, Dr. Harjeet. And we have members from SIPHER, Mrs. Neeru Mahajan, Mrs. Savita Verma, and we have representation from the media also, right? From Amar Ujala, from Indian Express.
राकेश, मैं एक पॉइंट अगर आप मुझे अलाउ करोगे तो कहना चाहती हूँ कि हम बिल्कुल हमें इंफ्रास्ट्रक्चर और सारी कम्युनिटी हेल्थ के लिए सर्विसेज इम्प्रूव करना ही चाहिए, हम करना चाहते हैं। और उसके साथ साथ मुझे बहुत इम्पॉर्टेंट लगता है कि हम डॉक्टर्स की सेफ्टी के ऊपर बहुत ज़्यादा ध्यान दें, बिकॉज डॉक्टर्स आर रियली थ्रेटेंड। अभी अर्चना शर्मा जी का सबको अभी मालूम है जैसे राजस्थान में हुआ। I mean, she was so stressed out that she had to take her own life. मतलब अगर ये डॉक्टर्स की सिचुएशन है तो I think we seriously need to look into the matter. Provide all measures so that doctors can work independently and in the best of conditions. So that हम करना क्या चाहते हैं कि पेशेंट को बेस्ट हेल्थ मिले, लेकिन उसके लिए डॉक्टर का हेल्दी होना और उसका स्ट्रेस फ्री एनवायरनमेंट में काम करना इज एज इम्पोर्टेंट. I can really assure you that.
Dr. Ramesh, I think. So please be short.
हाँ be short. NGOs ਵੱਲੋਂ ਤੁਹਾਨੂੰ ਕੁਝ assurance ਦੇਣੀ ਚਾਹੁੰਦਾ। ਅਸੀਂ ਪਿਛਲੇ 25 ਸਾਲ ਤੋਂ NGO ਸੈਕਟਰ 'ਚ ਕੰਮ ਕਰ ਰਹੇ ਹਾਂ। ਮੈਂ ਆਪ ਆਪਥਲਮੋਲੋਜਿਸਟ ਹਾਂ, ਡਾਕਟਰ ਚਰਨਜੀਤ ਦਾ ਮੈਂ ਐਕਸਟਰਾ ਸੀਨੀਅਰ ਸੀ ਤੇ ਮੈਂ ਤੁਹਾਨੂੰ ਇਹ assurance ਦੇਣੀ ਚਾਹੁੰਦਾ ਕਿ ਬਹੁਤ ਸਾਰੇ ਲੋਕ ਜਿਹੜੇ ਹੈ ਉਹ ਸੈਲਫਲੈਸ ਸਰਵਿਸ ਕਰ ਰਹੇ ਹੈ। ਪੰਜਾਬ ਇਸ ਚੀਜ਼ ਵਾਸਤੇ ਨੋਨ ਹੈ, ਭਾਈ ਕਨਈਆ ਦੀ ਧਰਤੀ। ਅਸੀਂ ਸਾਰੇ ਹੀ ਇਸ ਚੀਜ਼ ਦੇ ਵਿੱਚ ਕੰਟਰੀਬਿਊਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹਾਂ। ਸਾਨੂੰ ਕਿਹੜੀ ਚੀਜ਼ ਆਪਣੇ ਲੈਵਲ ਤੇ ਛੋਟਾ ਕੰਮ ਸਾਰੀਆਂ NGOs ਪੰਜਾਬ ਦੇ ਵਿੱਚ ਕਰ ਰਹੀਆਂ। ਕਿਹੜੀ ਚੀਜ਼ ਉਹਨਾਂ ਨੂੰ ਰੋਕ ਰਹੀ ਸੀ? ਗਵਰਨਮੈਂਟ ਦੇ ਐਟੀਟਿਊਡਸ ਜਿਹੜੀਆਂ ਪਹਿਲੀਆਂ ਪ੍ਰੀਵੀਅਸ ਗਵਰਨਮੈਂਟਸ, ਔਰ ਸ਼ਾਇਦ ਸਾਡੀਆਂ ਸਾਰਿਆਂ ਦੀਆਂ ਦੁਆਵਾਂ ਜਾਂ ਐਫਰਟਸ ਹੈਗੀਆਂ ਕਿ ਜਿਹੜੀਆਂ ਇੱਕ ਬਦਲਾਵ ਦੇ ਵਿੱਚ ਨੂੰ ਲੈ ਕੇ ਆਈਆਂ ਹੈਗੀਆਂ। ਔਰ ਸਾਰੇ ਹੀ ਦਿਲੋਂ ਚਾਹੁੰਦੇ ਹੈ ਕਿ ਅਸੀਂ ਇਸ ਗਵਰਨਮੈਂਟ ਦੀ ਸਪੋਰਟ ਕਰੀਏ ਤਾਂ ਕਿ ਇਹੋ ਜਿਹਾ ਮਾਹੌਲ ਕ੍ਰੀਏਟ ਹੋਵੇ ਕਿ ਲੋਕਾਂ ਨੂੰ ਜਦੋਂ ਇਸ਼ੂਜ਼ ਇਹਨਾਂ ਨੇ ਇਹੋ ਜਿਹੇ ਚੁੱਕੇ ਆ ਜਿਹੜੇ ਕਿ ਲੋਕਾਂ ਨਾਲ ਡਾਇਰੈਕਟਲੀ ਕਨੈਕਟਡ ਹੈ, ਐਜੂਕੇਸ਼ਨ ਐਂਡ ਹੈਲਥ। ਔਰ ਮੈਂ ਐਸ਼ੋਰ ਕਰਦਾ ਕਿ ਜੇ ਤੁਸੀਂ ਇਹ 5 ਸਾਲਾਂ ਦੇ ਵਿੱਚ ਐਜੂਕੇਸ਼ਨ ਔਰ ਹੈਲਥ ਨੂੰ ਦੋ ਚੀਜ਼ਾਂ ਨੂੰ ਪਕੜ ਕੇ ਲੱਗੇ ਲੈ ਆਏ ਤਾਂ ਮਤਲਬ ਤੁਹਾਨੂੰ ਇੱਥੋਂ 20 ਸਾਲ ਨਹੀਂ ਕੋਈ ਹਿਲਾ ਸਕਦਾ। ਜਿਹੜਾ ਅਸੀਂ ਸਾਡੀ ਗਰਾਊਂਡ ਦੇ ਵਿੱਚੋਂ ਫੀਲਿੰਗ ਹੈਗੀ ਹੈ। ਸਾਨੂੰ ਸੁਣਵਾਈ ਕਿਹੜੀ ਗੱਲ ਤੋਂ ਨਹੀਂ ਸੀ। 1 ਸਾਲ ਪਹਿਲਾਂ ਹੈਲਥ ਵੈਲਨੈਸ ਸੈਂਟਰਸ ਦੀ ਗੱਲ ਹੋਈ ਹੈ। 1 ਸਾਲ ਪਹਿਲਾਂ ਸੈਂਟਰਲ ਗਵਰਨਮੈਂਟ ਨੇ ਇਹਨਾਂ ਦੀ ਇੱਕ ਮੋਨੀਟਰਿੰਗ ਕਰਵਾਈ। ਉਹ ਮੈਨੂੰ ਕਰਨ ਦਾ ਮੌਕਾ ਮਿਲਿਆ ਕਿ ਲੁਧਿਆਣੇ ਦੇ ਸਾਰੇ ਹੈਲਥ ਵੈਲਨੈਸ ਸੈਂਟਰਸ ਦੀ ਮੋਨੀਟਰਿੰਗ ਕਰੋ ਕਿ ਇਹ ਠੀਕ ਚੱਲ ਵੀ ਰਹੇ ਜਾਂ ਨਹੀਂ ਚੱਲ ਰਹੇ ਜਾਂ ਕਿੰਨੀ ਸਕੀਮ ਸਕਸੈਸਫੁਲ ਹੋਈ ਹੈ। ਇੰਨਾ ਆਪਣਾ ਜ਼ੋਰ ਲਗਾ ਕੇ 1 ਮਹੀਨਾ ਅਸੀਂ ਉਹਦੀ ਰਿਪੋਰਟ ਬਣਾਈ ਔਰ ਉਹਦੇ ਕੁਝ ਪੁਆਇੰਟਸ ਕੱਢੇ ਕਿ ਹਾਂ ਇਹਨਾਂ ਚੀਜ਼ਾਂ ਦੇ ਨਾਲ ਐਗਜ਼ਿਸਟਿੰਗ ਇਨਫਰਾਸਟ੍ਰਕਚਰ, ਐਗਜ਼ਿਸਟਿੰਗ ਹਿਊਮਨ ਰਿਸੋਰਸਿਸ, ਐਗਜ਼ਿਸਟਿੰਗ ਫਾਈਨੈਂਸ਼ੀਅਲ ਸਰਵਿਸਿਜ਼ ਦੇ ਨਾਲ ਵੀ ਉਹਨੂੰ ਇੰਪਰੂਵ ਕੀਤਾ ਜਾ ਸਕਦਾ। ਉਹ ਇੰਨੀ ਬਣਾ ਕੇ ਸਾਨੂੰ ਉਹਦੇ ਵਿੱਚੋਂ ਕੀ ਮਿਲਣਾ ਸੀ ਅਸੀਂ ਉਹ ਗਵਰਨਮੈਂਟ ਨੂੰ ਦਿੱਤੀ, ਉਹ ਜਾ ਕੇ ਸਾਰੀਆਂ ਰੱਦੀ ਦੀ ਟੋਕਰੀ ਵਿੱਚ ਸੁੱਟੀਆਂ ਜਾਂਦੀਆਂ।
ਚਲੋ ਡਾਕਟਰ ਅਰਵਿੰਦ, I think we have to stop here. So one question each from the media.
I am not here to ask questions, sir. I am just giving the suggestion since it's a panel discussion. क्वेश्चन के लिए हम सर के पास कभी भी जा सकते हैं।
हाँ बिल्कुल।
कोविड कॉल आया सर, ठीक है जी। उसमें क्योंकि पंजाब में क्लिनिकल एस्टेब्लिशमेंट एक्ट लागू नहीं था तो मायो हॉस्पिटल जहाँ पे रेमडेसिविर बिक रही थी उन पे केस हुआ और मात्र 200 रुपये में वो छूट भी गई। आज वो बाहर। ये ऐसी सजेशन हैं क्योंकि एक्ट यहाँ लागू नहीं है। आई एम नॉट सेइंग कि सभी डॉक्टर ऐसा कर रहे हैं, पर जो कर रहे हैं वो बहुत इजीली कर रहे हैं। क्लिनिकल एस्टेब्लिशमेंट एक्ट में ये कहना कि वो डॉक्टर फ्रेंडली होना चाहिए, मेरे ख्याल से ये कहना चाहिए कि वो डॉक्टर और पेशेंट फ्रेंडली होना चाहिए, 50-50 दोनों दायरे में। अगर आप 70% उसे डॉक्टर फ्रेंडली कर लेंगे और 30% पेशेंट फ्रेंडली करेंगे, इसमें कोई पर्पस सॉल्व नहीं होगा। सेकेंड थिंग, मेरे ख्याल से ये डॉक्टर्स मेरे साथ अग्री करेंगे, पंजाब में कोविड काल में सबसे ज़्यादा मोर्टेलिटी इवन दिल्ली में भी हुई है। दिल्ली के पेशेंट यहाँ आ रहे थे, हम मोहल्ला क्लिनिक जितना मर्जी कह लें, वहाँ पे मोहल्ला क्लिनिक उस टाइम पे फेल थे जब ऑक्सीजन की ज़रूरत थी। मैं उसमें नहीं जाना चाहती, बस इतना कहना चाहती हूँ कि पंजाब में जो डॉक्टर्स हैं मैक्सिमम जो गवर्नमेंट सेटअप में काम कर रहे हैं, स्पेशली एनेस्थीसिया में, दे डू नॉट नो हाउ टू इंट्यूबेट अ पेशेंट। ये मैंने खुद देखा है, मैंने ग्राउंड रिपोर्टिंग की है, मेरे साथ एनेस्थीसिया के डॉक्टर होते थे। इतना तो हमें भी समझ में आ रहा है कि वो पेशेंट को ना सेंट्रल लाइन डाल पा रहे हैं ना इंट्यूबेशन कर पा रहे हैं। तो इससे बेटर कि आप मोहल्ला क्लिनिक यहाँ पे डेवलप करें, तो पहले डॉक्टर्स के अंदर ज़ील लाना ज़रूरी है कि वो काम कर लें, स्पेशली गवर्नमेंट सेटअप. Any immediate plans for screening, especially cancer screenings, because Punjab is turning out to be a cancer capital of the country. So, कुछ ऐसा plan which you could share or
same question.
Sir, I will request you to now.
Thank you. Hello. Hello.
बेटा दूसरा करें माइक.
Hello. 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 Thank you, Department of Humanity Medicine and Science of Public Health, PGI Chandigarh, IMA Chandigarh and SIPHER, Dr. Rakesh, Dr. Mr. Hon'ble, जिन्हें सारे ने आज मौका दिता थोड़े बैठ के जो डिस्कशन करनी. उस तो पहला कि अपा अगे पंजाब गवर्नमेंट का जो विजन है वो गल करिए. मैं गल करना मैडम ने जो गल की है कि क्लिनिकल एस्टैब्लिशमेंट बिल है दैट शुड बी बहुत पेशेंट एंड डॉक्टर फ्रेंडली 70-30 not like this. I want कि doctor and patients what should be friends. This is not the matter of कि it should be patient friendly or doctor friendly. It should be for the benefit of both public and there should be no scare to doctor also. तो doctor पे inspectory राज नहीं होना चाहिए. He or she will not be able to deliver in that atmosphere. So we want कि this bill should be सोसाइटी फ्रेंड. उस सोसाइटी में डॉक्टर्स भी आते हैं, पेशेंट भी आते हैं. सो वी नॉट वांट के इस तरह का कोई माहौल हो. कोई भी आदमी, खासकर डॉक्टर, कभी जब उसको इनसिक्योरिटी लगेगी तो वो काम नहीं कर पाएगा. जब पेशेंट को लगेगा यार मैं यहाँ ठीक नहीं होता तो वो ट्रीटमेंट भी नहीं करवा पाएगा. सो इट शुड बी लाइक दिस कि बहुत पेशेंट एंड डॉक्टर शुड गो टुगेदर so that पेशेंट को भी लगे कि वाकई मेरी केयर हो रही है. बेशक वो बिल ऐसा भी है और उसके लिए आई एम स्टडीइंग जो बिल आया लास्ट टाइम तो IMA पंजाब पीपल केम टू मी. तो कुछ ETP प्लांट वो काफ़ी इशू थे. तो ऐसा होता है कि अगर हम ऐसी क्लिनिकल एस्टेब्लिशमेंट बिल इसको इन्फोर्स करेंगे तो ट्रीटमेंट भी बहुत महंगा हो जाएगा. तो जो उसकी रिक्वायरमेंट्स हैं वो सारा देखना पड़ेगा. क्योंकि ऐसा ना हो कि कॉर्पोरेट फ्रेंडली हो जाए और जो प्रैक्टिशनर है सिंगल डॉक्टर कर रहे हैं, 2 डॉक्टर कर रहे हैं. और सो वी हैव टू लुक इनटू द मैटर और वी वांट के इट शुड बी पीपल फ्रेंडली. उन लोगों में डॉक्टर भी आते हैं, पेशेंट भी आते हैं. स्क्रीनिंग की बात मैम ने पूछा. सो वी हैव लॉन्च्ड अ कैंपेन और अभी हमने MOU साइन किया है. जैसे मेमोग्राफी पहले अल्ट्रासाउंड से थी और टचलेस हो गई ना वो मतलब रॉश कंपनी है उनके साथ हमने किया है. दे विल स्टार्ट नेक्स्ट वीक. हर एक डिस्ट्रिक्ट हॉस्पिटल्स में जाएंगे और एक वीक का कैंप लगेगा और जो सारे मतलब लेडीज हैं वो 30-40 सभी वैसे फॉर ऑल दिस विल बी फ्री ऑफ कॉस्ट. और वो स्क्रीनिंग वी आर स्टार्टिंग. उसमें MOU साइन हो गया, मेरे साइन भी हो गया, डिपार्टमेंट के भी हो गए और दे विल स्टार्ट वर्क फ्रॉम नेक्स्ट मंथ. हाँ, डिस्ट्रिक्ट हॉस्पिटल्स में कैंप लगाएंगे. वो पेशेंट आता है हर डिस्ट्रिक्ट में करेंगे. और मतलब आई एम वेरी हैप्पी कि हमारे 10-12 MLAs डॉक्टर हैं. डॉक्टर चरणजीत सिंह, डॉक्टर बलजीत है ना. डॉक्टर चरणजीत
first in the history of Punjab Legislative Assembly to have this much of doctors.
Yes, not only the history of Punjab, but the history of India. Maybe world over. So, Dr. Charanjit मेरे एरिया में इन्होंने बहुत काम किया है. He was poster there और कैंप्स बहुत ऑर्गेनाइज.
चन्नी जी तो पीछा जुड़ा था.
ਚੰਨੀ ਜੀ ਤੋਂ ਚੱਲਦਾ 3 ਕਰੋੜ ਲੋਕਾਂ ਨੇ ਪੰਜਾਬ ਦੇ ਚਲਾਇਆ ਉਹਨਾਂ ਤੇ ਸਾਡੇ ਇੱਕ मैं कहूँगा लेफ्टिनेंट जनरल है
नो डाउट सॉरी टू इंटरप्रेट नाम से मैं सोचन नहीं पाटो a better version
so आज ਆਪਾਂ बड़ा इंपॉर्टेंट इशू है हेल्थ ਦਾ ਬਿਨਾਂ डिस्कस ਕਰਨ ਲਈ ਸਾਰੇ ਬੈਠੇ ਆ ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਵੀ ਪਹਿਲੇ ਗੱਲ ਕੀਤੀ ਹੈ ਇਸ ਤੋਂ ਪਹਿਲਾਂ ਅੰਬੇਦਕਰ ਇੰਸਟੀਚਿਊਟ ਥੋੜਾ ਪ੍ਰੋਗਰਾਮ ਸੀ ਅਵਾਰਡ ਹੈਲਥ ਦੇ ਉੱਥੋਂ ਅਸੀਂ ਅੱਜ 3 ਆਡੀਓ ਵਿਜ਼ੂਅਲ ਵੈਨਸ ਆ ਜਿਹੜੀਆਂ ਉਹ ਸਟਾਰਟਡ ਕੀਤੀਆਂ ਫਰੋਮ ਸਟੇਟ ਹੈਲਥ ਡਿਪਾਰਟਮੈਂਟ ਫॉर ਸਪਰੈਡਿੰਗ ਅਵੇਅਰਨੈਸ ਅਬਾਊਟ ਕਲਾਈਮੇਟ ਹੈਲਥ ਮੈਗਜ਼ੀਨ ਅਮੰਗ ਦਾ ਪੀਪਲ ਸੋ ਦੇ ਵਿਲ ਗੋ ਟੂ ਐਵਰੀ ਵਿਲੇਜ ਆਫ our Punjab aware the people regarding the diseases how to take care and all also health magazine or YouTube has been launched ਤਾਂ ਜੋ ਸਾਡੀਆਂ ਕਿਸ ਤਰ੍ਹਾਂ ਬਚਿਆ ਜਾ ਸਕਦਾ ਹੈ ਜਿਸ ਤਰ੍ਹਾਂ ਕਹਿੰਦੇ ਇਲਾਜ ਨਾਲੋਂ ਪਰਹੇਜ਼ ਚੰਗਾ ਉਹ ਸਾਰਾ ਕਮਿਊਨਿਟੀ ਮੈਡੀਸਨ ਪਲੱਸ ਜੋ ਸਾਡਾ ਡਿਪਾਰਟਮੈਂਟ ਹੈ ਮਾਸ ਮੀਡੀਆ ਉਹਨਾਂ ਨੂੰ ਇਨਵੋਲਵ ਕਰਕੇ ਅਸੀਂ ਉਹਦੇ ਸਟਾਰਟ ਕੀਤਾ ਔਰ ਜੋ ਮੈਂ ਨੋਟ ਕਰ ਰਿਹਾ ਸੀ ਕੁਝ ਗੱਲਾਂ ਜਿਹੜੀਆਂ ਆਈਆਂ ਪਹਿਲਾਂ ਉਹਨਾਂ ਦੇ ਡਿਸਕਸ ਥੋੜਾ ਕਰਾਂਗੇ ਜਿਸ ਤਰ੍ਹਾਂ ਰਾਜਸਥਾਨ ਚ ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਉਹ ਸੈਟ ਕੀਤਾ ਦੈਟ ਇਜ਼ ਵੈਰੀ ਪੇਨਫੁਲ ਸੋ ਦਿਸ ਟਾਈਪ ਆਫ ਐਟਮੋਸਫੀਅਰ ਜੋ ਇੱਕ ਲਾਸ ਆਫ ਫੇਥ ਪੇਸ਼ੈਂਟ ਔਰ ਡਾਕਟਰ ਚ ਹੋਇਆ ਪਿਛਲੇ ਖਾਸ ਕਰਕੇ 15 ਸਾਲ ਤੋਂ ਮੈਂ ਦੇਖ ਰਿਹਾ ਹਾਂ ਉਹ that we have to restore